This is a summary of the CPIC dosing guideline for aminoglycoside antibiotics and variation in the gene MT-RNR1. This guideline was published in May 2021. Due to the increased risk of aminoglycoside-induced hearing loss caused by certain MT-RNR1 variants, the guideline recommends that aminoglycosides be avoided in patients with the 1095T2C, 1494C2T, or 1555A to G variants. This image is derived from the pharm-GKB aminoglycoside ototoxicity pathway. It shows the actions of aminoglycosides in bacterial cells and in inner ear sensory hair cells. A link to the original pathway is given in the description below this video. Aminoglycoside antibiotics are used to treat infections of gram-negative bacteria. They work by binding to the 16S ribosomal RNA subunit in bacterial cells. This binding inhibits translation of protein from RNA and leads to cell death. MT-RNR1 encodes the 12S mitochondrial ribosomal RNA subunit in eukaryotes, including humans. Some variants in this gene can change the structure of the 12S subunit so that it closely resembles the structure of the bacterial 16S ribosomal RNA subunit. The 1555G allele is used here as an example. Aminoglycosides can bind to these altered 12S ribosomal RNA molecules in inner ear sensory hair cells. This inhibits translation in these cells, causing cell death and ultimately hearing loss. This guideline is the first CPIC guideline on a mitochondrial gene. As such, there are several key differences which should be considered when using this guideline. Because MT-RNR1 is a mitochondrial gene, it is maternally inherited. That is, it is only inherited from an individual's mother. As mentioned on the previous slide, MT-RNR1 encodes a ribosomal RNA molecule and not a protein. The mitochondrial genome is haploid, meaning that there is only one chromosome present, rather than the pairs of chromosomes in the cell nucleus. This means that only one nucleotide is found at each position in MT-RNR1. As an example, patients can have either the A allele or the G allele for the 1555A to G variant, but cannot have AA, AG, or GG genotypes. Patients can be assigned an MT-RNR1 phenotype based on the presence of certain variants in this gene. This table shows the different phenotypes that can be assigned along with example genotypes. This information can also be found in Table 1 of the guideline. Gene information tables for MT-RNR1 are available on the pharm-GKB website. A link to these tables is given in the description below this video. Note that the effects of some MT-RNR1 variants on the risk of aminoglycoside-induced hearing loss have not yet been characterized. These are listed as having an uncertain risk of aminoglycoside-induced hearing loss and should be interpreted with caution on a genetic test. An important caveat for all genotyping tests is that a reference allele status is given to all alleles which are not detected in the assay. This can include rare alleles which could increase the risk of aminoglycoside-induced hearing loss and which are not routinely screened for in some genotyping tests. These are the CPIC dosing recommendations for aminoglycoside antibiotics by MT-RNR1 phenotype. Patients with MT-RNR1 variants which increase their risk of aminoglycoside-induced hearing loss will have a very high risk of developing hearing loss if treated with aminoglycosides. Aminoglycosides should be avoided in these patients unless the high risk of permanent hearing loss is outweighed by the severity of the infection and the lack of safe or effective alternative therapies. This is a strong recommendation. If no effective alternatives to aminoglycosides are available, the patient should be frequently evaluated for hearing loss during aminoglycoside treatment and all appropriate precautions should be utilized. These include using the lowest possible dose and the shortest possible duration of treatment, use of therapeutic drug monitoring, hydration, and monitoring of renal function. Patients with MT-RNR1 variants which do not alter their risk of aminoglycoside-induced hearing loss will have a normal risk of developing hearing loss if treated with aminoglycosides. Aminoglycosides can be used in these patients at standard doses for the shortest feasible course and with therapeutic drug monitoring. This is a strong recommendation. Individuals who do not have variants which are known to increase their risk of aminoglycoside-induced hearing loss are still at risk of developing hearing loss when treated with aminoglycosides, especially when high drug levels or prolonged courses are used. MT-RNR1 variants with an uncertain effect on a patient's risk of aminoglycoside-induced hearing loss have weak or no evidence available to link these variants to an increased risk of aminoglycoside-induced hearing loss. Aminoglycosides can be used in these patients at standard doses for the shortest feasible course and with therapeutic drug monitoring. This is an optional recommendation. Individuals who do not have variants which are known to increase their risk of aminoglycoside-induced hearing loss are still at risk of developing hearing loss when treated with aminoglycosides, especially when high drug levels or prolonged courses are used. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where an activity summary can be given for specific MT-RNR1 alleles. The activity summary includes implications for the patient's response to aminoglycosides, the appropriate dosing recommendation for the specific phenotype, and the strength of that recommendation. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.